Hi everyone. Today I have a very special guest with me, Effath Yasmin, who is India's leading IBCLC and a biodynamic craniosacral therapist from Bombay. She is also the founder director of Nourish and Nurture, which is her center where she deals with infant oral and suckling dysfunction. She especially specializes in tongue tie assessment, its treatment and rehabilitation, biomechanics of breastfeeding, and its treatment of birth trauma, anxiety, and depression. She also serves on the National Board of Birth India and the International Advisory Board of ICAP and Global Conferences. And she's also been the producer director of an award winning documentary, Untying Breastfeeding, which has been screened across many countries. So, thank you, Effath, for being a part of our interview series. I thought let's start off with discussions on breastfeeding. Now, everyone knows the importance of breastfeeding, I feel, in today's day and age, and a lot of women want to do it. But when they start the process, especially in the first few days after childbirth, they notice that they have some difficulties. They feel like there's not enough milk, the baby isn't getting satisfied. And I hear a lot of mothers coming and telling me, maybe I'm just not producing enough. And I would like you to probably discuss your expert opinion on this.
Okay, so if you so you're right about it that the number one question that young mothers have when they start, wanting to breastfeed their babies right after birth, is that they search on the internet looking for how do I know if I have enough milk, or do I have enough milk? How do I increase my milk? So these are the topmost questions that are searched across the world, not just in our country, but I think it's across the world. So I think it stems from one of the key things here that which often many of the people who support the young mothers, don't realize is that this young baby who's born is completely 100% dependent on the mother for nutrition and for survival and thriving, actually. So that's a huge responsibility a mother takes on, and it's her body that needs to kind of nourish that baby. So it's really that critical. And so it is natural for a mother to feel a sense of anxiety and nervousness around this, especially because we have charts that show growth charts, and they are measured of how many kilograms a baby has to be, what is the weight gain like. So all these factors play a huge role on how the mother feels about herself. And there is definitely a lack of confidence that comes in, especially around exclusive breastfeeding period, which is the first 6 months. So while we are countering it by giving breastfeeding counseling from many organizations across the world, including the WHO, and then you have other organizations which are locally there also, like the Breastfeeding Promotion Network of India within India. These are very crucial support that's being provided to mothers to let them know or build their confidence of how they can exclusively breastfeed baby, and to have confidence that their bodies can make enough milk. But having said that, we must not forget that there is an epigenetic impact of the fact that we are living in an environment that has not been the most conducive for growing girls. So there is an impact on the kind of nutrition we have, the toxicity that is there in the environment. All these will play a role on how our bodies are developing. So there are some factors that may impact milk supply, and also how birthing process itself is supported. One of the key most important kickstart of good breastfeeding with good amount of milk is how the mother is supported during birth. And if there are interventions such as medications that might be probably used, or epidural is used, or maybe there's a forceps birth, or there's an help with vacuum birth, or maybe cesarean sections, which has been on a rise, then you kind of derail the process of the breastfeeding, because it's a very fragile balance of hormonal dance that happens within the mother's body right after birth, and that can get tipped off, or rather be interfered with through this process. rather the people who are supporting during birth hardly have an idea that this can actually change the dynamics of breastfeeding later. That's another big disconnect. And you have to intervene, which could be a medical reason, for example, because either using a vacuum forceps or cesarean sections could actually be a life-saving process sometimes for a mother and baby. But if we have had to intervene, where is the continuity of care after that? That it can imbalance how the breastfeeding dynamics is going to play a role. Or perhaps the mother is going to go into, she could be at a bigger risk for depression, for example, because she's not able to feel confident that her milk is enough for the baby, or her hormones are not functioning in the best way. So all these can impact. So if we understand the need for continuity of care, I think this can be taken care of. Absolutely.
In your practice, how many percentage of women do you feel actually are not capable enough of producing enough milk for their child?
So that's an interesting question again, because in my practice, most of the mothers who come have had major issues during birth. So they've gone through many different interventions, and they've gone through severe birth trauma, most of them, because my clinic is a high risk clinic. So therefore, you are only getting that population of the young mothers who have gone through quite a bit during birth and after that. So having said that, my concentration or my work or my clinical approach towards this is that I take the sense of the mother away from trying to chase her milk supply. Because the moment she starts to do that, that's a race that she's not going to win against an industrial formula that's present. You see, that can be produced in tons and tons, but a mother got to produce for her baby, so she's not going to compete with that. So the best thing I could do at this point is to counsel her in such a way that her mind is not driven towards trying to chase every ounce and every drop of her milk. Having said that, supporting her to increase her milk supply by getting the focus back to where it needs to be, which means identifying the causes of where this imbalance can happen. So those could be, like I mentioned, if there is a birth trauma for the mother as well as for the baby, then we counsel them get her back on track to make her understand that these are factors that could be playing a role and how therapeutic support can change that. So then her focus is on the baby and how to restore back her self-confidence, and then also keep working on the milk supply, which is on the hindsight and not on the forefront of the focus. So then slowly she comes back to it. And honestly, if you ask me, I'm yet to see more than a handful of mothers who really have a milk supply issue. But having said that, they need support. They need support to get there. When they come to say that there is a milk supply issue, absolutely they do have a milk supply issue at that point, but that's secondary and it's not primary. So this is another key importance that we need to differentiate, that what is secondary and what is primary. Primary is a failure of body being able to produce milk, which is not true. We have very, very rare cases that might happen. But having said that, there is secondary issues that will lead you into a milk supply issue, such as the ones that I just discussed with you. So yes, so we do need to acknowledge that there is a milk supply issue, but that's a secondary one and can be supported to go back to it. Yes. So one of the key things I try to establish when they come in for a prenatal, orientation or a consultation, which is approximately about 2 hours of orientation that I sometimes do when they come in. The first thing I try to establish is to hear where is she in her journey of the pregnancy, right? And where is she in her journey as a woman? And then usually that comes out with just a simple conversation that I might have with her and with her and her partner. Usually, then they start to talk about it. This is what I've heard and this is what I know about. And then I start to orient her towards, where is she in her journey of how is she preparing for her birth? And what is she envisaging her birth to be? Because like I mentioned, the key importance is to know the link between the birth and what happens after, which is breastfeeding, which is a very fine, fragile handover, sort of a handover from the birth to breastfeeding, where the baby is, feeding from the umbilical cord and getting the nutrition from the cord then moves towards the breast and gets attached. So that's the movement that happens from the abdomen to the breast, and that's the beauty. And often we kind of miss that link. So usually the orientation is towards how the birth should be, or rather how can she envisage and how can she support her birth, and to go back and have a chat with their care providers, such as their gynecologist, obstetrician, so that they can understand where are they coming from, and what kind of support are they going to get in the hospital, and how can they meet their needs of movement for the mother during birth, and how can she use her intuitive sense to be allowed to have the empowering birth that she is looking forward for, because it's a natural event, it's a natural process that's happening in the body. So as much as what we can do as care providers around her is to be able to give her that loving atmosphere and sense of autonomy to be able to do what she's capable of doing. And that is the key change that we like to bring for preparation of breastfeeding. There's less talk about breastfeeding, but more talk about the birth. And they realize that, oh yeah, that's what I need to do to be prepared for breastfeeding. But of course, there are some key points that I do discuss, is that letting the hospital or the place that they're going to birth to know that the baby can be given to the mother immediately after birth. That's one of the crucial things which the WHO also talks about, Jackson, where the golden hour, which is called the golden hour, within the first 1 hour of birth, the baby must be given to the mother, and all processes of checking the baby, wiping the baby, everything can be done on the mother's body. So the mother and baby need not be separated, or at least reduce the impact of separation between the mother and baby. That's one of the key things. And then allowing the baby to experience the empowering movement from the abdomen of the mother to the breast, which is often called as the breast crawl as well, which is also not experienced by a lot of mothers actually. So that ability for the baby to use the primitive reflexes to move on its own and find the breast and latch and feed is one of the most beautiful experiences mothers can have. And if they can be provided that, it'll be absolutely wonderful. So those are few pointers that we talk about. And then to know what are your parameters of knowing if the baby is, what is the need of the baby, how much milk should a baby have, what are those 4 factors, key factors that allows her to be confident that the baby is having enough milk. So those are few orientations that I try to give during the prenatal.
Specialized in tongue tie, and I know that this is an issue which has recently taken up importance, where people are now aware that this is what's actually restricting their child from latching on, from getting the correct feed. So could you talk to us a little bit about how many what's the incidence of it, how frequently do mothers encounter it, and how will a mother know or be able to understand based on the symptoms that the child could have a possible tongue tie?
Okay, so that's another important area of orientation, which I often don't talk about during the prenatal class, because you don't want to anticipate an issue that might come later. We just orient them to more towards health and what can be normal. But if they have issues, yes, then we then get oriented towards knowing exactly what's going on there. So if you look at the incidence of it, the research does not show it's not a comprehensive research. Research is hugely lacking in this field of understanding about tongue ties, and it's very recent that we have started to look at this as a condition that might be impacting breastfeeding. Then show somewhere about 2 to 3% of the population of the newborn. But in my practice and what we have been seeing across the world, although we don't have research data, we can easily say about 10 to 15% of babies seem to definitely have this issue of tongue tie. And also some of the other countries go up to even talking whooping changes of almost 50% of babies. That's a lot. Like, we really cannot, that's a range that we are seeing right now. 20%, somewhere in Brazil we had around approximately 20%. But if you ask me what are the various signs a parents should look for if they think that they might have an issue because of a tongue tie, yes, like you mentioned, sometimes latch can be an issue, But primarily in my practice, I've noticed that uh, non-latching baby, the major reason that comes from that is the lack of good support during birth. And birth trauma can be one of the most significant reasons why a baby is not latching. However, there are smaller percentage of babies who cannot latch because of a tongue tie also. So there are always layers of one on top of the other. So it's not just one reason. So you need to look at the layers and then look at what are the compensations the baby has and then try to support. But the mother could have painful feeding. The mother could have misshapen nipples. Nipples could be misshapen when she breastfeeds. They could be bleeding. Sometimes they could be completely, cracked open. So those could be some of the issues. Babies' issues could be babies not gaining very well, or baby could be, gaining sometimes more than average. You also have babies who are, growing enormously, but still not happy babies, having reflux, for example, having issues with digestion, with sleep sometimes, and cranky babies, and babies not being able to breastfeed on one side of the breast. So those are very, very prevalent, common things that you see. And mother could experience blocked ducts or sometimes abscess. So those are again other issues that you can see. So these have, um, you know, other reasons as well, which can be definitely taken care of with excellent lactation support, but they're also the ones that can be contributed because of a tongue tie.
Which is that you deal with a lot of postpartum depression and anxiety cases. So, again, that's something that's recently gained a lot of traction. People are now coming out in the open about it. They are seeking help about it. And I'm sure a lot of mothers went through it before, but they didn't get that kind of attention and care that they needed. So, could you discuss a little bit about that in terms of what you are seeing now in your practice?
Sure. So if you look at, postpartum depression, that can be kind of defined into two different major broad categories. One is the postpartum blues, which are, usually seen for a couple of weeks after birth, and usually starts to kind of get restored on its own because of the various hormonal changes. And it's generally a period of very nervous first few weeks after birth, because your baby is like very little, and there's absolutely no sleep for the parents, and there are hormonal changes that are occurring on the mother, and she might have gone through a very difficult birth sometimes. So, and then there is also lack of social support, like, not enough family and loving family around. So a lot of families have started to live on their own, so those can be major issues as well. So if you look at these, they could be postpartum blues that usually doesn't last for more than a few weeks. That's one of the reasons why traditionally mothers were taken care of with giving a lot of social support and love and care, including nutrition during the first 6 weeks. If you know, the first 6 weeks are considered to be almost like the confinement time, where a mother and baby is not allowed to be going out. And there are reasons for that, because that allows them to kind of settle into the new life with the baby. So that's very supportive, and I definitely would like most parents to kind of go by that tradition and enjoy that period of confinement. But having said that, the other part of it, which is basically more severe, which is called postpartum depression, that could be called as even postpartum psychosis, it's a long-term impact. And a lot of the people that you are talking about today are not just going through postpartum blues, but they're actually going through postpartum depression, which is setting itself into a chronic state which lasts for many years sometimes. And the depression could be multifold, like I mentioned. One is because of the kind of difficult birth they might have had, or a disassociation for the kind of, the body has a certain experience, Raksin, in the sense to say that the body would is oriented towards a normal process of birth and breastfeeding. And if that is intervened, even if cognitively we don't realize it, or we think that it's okay to have these kind of normal interventions considered to be a part of the hospital process or hospital protocols, or even a birthing home process, what we don't realize is that the body then starts to kind of disassociate itself. that this is not what is considered to be a blueprint of the body's natural process, and it seems to have deviated from that. And that's when depression then kicks in, and then exacerbated by hormonal changes, exacerbated by what might be happening, separation between mother and baby right after birth, and sometimes it can last for a couple of days. I've heard mothers come to me and say, oh, my baby wasn't given to me until 72 hours, which is 3 days, 4 days sometimes. And if some babies have been put in the observation for NICU, NICU, that could last a longer time actually. Or the baby could be having jaundice, for example, and then there is again separation. And then she already feels that I'm not being producing enough milk, that which we already discussed. So it's like a whole bunch of issues together, and it overwhelms the mother, and then she might be going through a postpartum depression. And usually in my practice, when I'm doing therapeutic work, which is craniosacral biodynamic work, um, postpartum depression is addressed to almost every mother who comes to the clinic. So it's a very high prevalence amongst at least high risk issues. You do find a lot of mothers going through postpartum depression, and they might not be aware of it. They are constantly weepy, they cry, they feel like, oh, everything is, they don't feel happiness that their baby is with them, and they feel a disconnect there. And so this is a part of the evolution, that if the baby is breastfeeding directly, and the mother has the confidence that everything is going fine, then that's a different matter. But if she has had interventions and she doesn't feel the confidence of it, she feels like even if the baby is right in front of her, she feels like, oh, maybe my baby is not there. So that disconnection is the grief that sets into the mother, that causes depression, or rather comes out as a form of depression. And craniosacral biodynamic work, which I use in my clinic as an approach towards supporting mothers along with nutrition, is an excellent modality for taking care of depression. And the wonderful part of that is that I'm able to do this work remotely with the therapeutic work. So usually, say about 5 or 6 sessions are sufficient for taking care of depression, which is 1 session a week. So matter of, say, about a month's time, not even a month's time, about 3 weeks time, the mother is feeling really very good, and she feels like she's gone back to being, happy, welcoming the baby into her life. So it's really a big turnover, and mothers love being supported this way, and they feel like, oh, I didn't know that I can feel this kind of joy that my baby is with me. Even more than postpartum depression, you also have breastfeeding grief, not being able to feed the baby. So even that is something that's not talked about often. So I'm glad you brought this up as a topic today.